Cancer. It's a word that strikes fear into the hearts of many. We often associate it with grueling treatments and uncertain outcomes. But there's another side to cancer treatment: the relentless nausea and vomiting. Chemotherapy drugs kill rapidly dividing cells, including healthy ones in the digestive system. This leads to nausea and vomiting, severely impacting patients' quality of life. Addressing CINV is crucial for improving patients' overall well-being. The medical community has long recognized the debilitating effects of CINV. Various anti-nausea medications known as antiemetics help manage these side effects. These medications aim to block the signals in the brain and body that trigger nausea and vomiting. While effective for some, they often come with limitations and drawbacks. Many patients find these medications provide only partial relief. This can be incredibly frustrating for those already dealing with cancer treatment. Imagine feeling constantly on the verge of being sick, despite taking medications. Persistent nausea can overshadow every aspect of their lives. Traditional antiemetics can also cause a range of side effects. These side effects can range from mild annoyances like drowsiness and constipation, to more serious issues like headaches, dizziness, and even movement disorders. For patients already struggling with chemotherapy, these side effects add to their burden. This is particularly concerning for patients with pre-existing health conditions. The limitations of traditional antiemetics have led many to explore alternative therapies. This search is driven by a need for relief and effective, well-tolerated treatments. Patients are increasingly seeking natural remedies and therapies that address the whole person. This reflects a desire for a more patient-centered approach to cancer care. CINV impacts every aspect of a patient's life, affecting relationships, work, and well-being. Simple pleasures like sharing a meal become a source of anxiety. The constant threat of vomiting can make patients hesitant to leave the house. This can lead to social isolation and difficulty maintaining a consistent schedule. The financial strain of managing CINV adds to the emotional burden. It's a constant battle to reclaim a sense of normalcy and find joy in everyday life. The medical community has developed an arsenal of antiemetics to combat nausea and vomiting in chemotherapy patients. These medications work through various mechanisms to disrupt the vomiting reflex. Some block serotonin or dopamine receptors, while others speed up stomach emptying. These medications represent years of research, providing relief and improving quality of life for many patients. When standard weapons fall short, traditional antiemetics often provide only partial relief or none at all. The constant queasiness and fear of vomiting cast a long shadow. Some patients experience anticipatory nausea, a psychological response. Severe nausea from harsh chemotherapy can be hard to control. Side effects like drowsiness and dizziness further burden patients. Section 3. Seeking new allies. A glimmer of hope in ancient remedies. Faced with the limitations of conventional antiemetics, many patients and their families are turning to alternative therapies. Medical marijuana has emerged as a promising contender with a long history of use for relieving nausea and vomiting. Once on the fringes, medical marijuana is gaining acceptance as research highlights its therapeutic potential. Derived from cannabis sativa, it contains cannabinoids like THC and CBD. These interact with the body's endocannabinoid system, regulating processes like nausea and vomiting. THC reduces nausea by interacting with brain and gut receptors. CBD, non-psychoactive, has anti-nausea and anti-inflammatory properties. Medical marijuana for CINV is supported by scientific evidence. Preclinical studies show cannabinoids' efficacy in animal models. Clinical trials show medical marijuana reduces chemotherapy-induced nausea and vomiting. Section 4. Beyond anecdotes, rigorous science enters the battleground. Clinical trials show medical marijuana can reduce nausea and vomiting, often more effectively than conventional drugs. Objective measures confirm its therapeutic potential for CINV. Legalization is expanding, providing access to this therapy. Not all medical marijuana is created equal. Cannabinoid profiles and dosages vary. Standardized formulations ensure consistent dosing. Inhalable forms provide rapid relief but pose risks. Oral forms offer longer-lasting effects. Consult a knowledgeable healthcare professional. Determine the best formulation and dosage for individual needs. A different kind of relief. How medical marijuana works. Medical marijuana doesn't fight nausea in the same way as traditional antiemetics. Instead of simply blocking signals in the brain, it works in harmony with the body's natural systems. Deep within our bodies exists a complex network called the endocannabinoid system, or ECS. This intricate system plays a crucial role in maintaining balance or homeostasis across various bodily functions, including mood, appetite, sleep, and even pain perception. Think of the ECS as a conductor, ensuring all instruments in an orchestra play in sync. And just like an orchestra relies on skilled musicians, the ECS relies on its own set of players, endocannabinoids. These naturally produced molecules bind to specific receptors throughout the body, much like a key fitting into a lock. This interaction triggers a cascade of events, fine-tuning various physiological processes to keep everything running smoothly. Now this is where medical marijuana enters the picture. Cannabinoids, the active compounds found in the cannabis plant, possess a unique ability to interact with the ECS. THC, for instance, primarily binds to CB1 receptors, which are concentrated in areas of the brain associated with nausea and vomiting. By interacting with these receptors, THC effectively disrupts the signals that trigger those unpleasant sensations, offering much-needed relief for patients. CBD, on the other hand, while not directly psychoactive, interacts with a broader range of receptors, including those involved in inflammation and pain, further contributing to its therapeutic potential in managing CINV and other chemotherapy-related side effects. THC and CBD, the two most prominent cannabinoids in medical marijuana, work together to combat nausea and vomiting. THC targets the brain's vomiting center, reducing the urge to vomit and influencing serotonin, which plays a role in nausea. CBD, with its anti-inflammatory properties, soothes the irritated stomach lining, often aggravated by chemotherapy. This dual action makes THC and CBD particularly effective in managing CINV. CBD also modulates the psychoactive effects of THC, reducing anxiety and paranoia. This modulating effect makes the overall experience more tolerable for patients. The interplay between THC and CBD highlights the complexity of the cannabis plant and its therapeutic benefits. It's about a symphony of interactions within the body's systems. The ratio of THC to CBD can be adjusted to suit individual patient needs. For some, a higher THC content might be necessary, while others may benefit from a balanced THC-CBD ratio. Real-world results. Studies that speak volumes. The science behind medical marijuana's effect on CINV is compelling, and patient experiences provide real proof. A landmark study in JAMA Oncology found significant reduction in nausea and vomiting with medical marijuana. Another study in cancer reported greater reduction in nausea severity with a THC-CBD oral spray. These findings represent a consistent trend across numerous studies, solidifying medical marijuana as a viable treatment for CINV. Patients often find relief where traditional antiemetics fail, improving their quality of life. Personal stories of relief from CINV thanks to medical marijuana paint a vivid picture of its transformative power. The use of medical marijuana for managing CINV is backed by scientific evidence. Numerous clinical trials evaluate the safety and efficacy of cannabinoids for alleviating chemotherapy-induced nausea and vomiting. One trial in the Journal of Clinical Oncology found synthetic THC significantly reduced nausea and vomiting. These trials often involve rigorous methodologies, including randomized controlled designs and double-blind procedures. Randomized controlled trials ensure observed differences in outcomes are due to the treatment itself. Double-blind procedures eliminate potential bias in data collection and interpretation. Standardized outcome measures assess the effectiveness of medical marijuana in managing CINV. These measures include the frequency and severity of vomiting episodes and the impact on daily functioning. By using standardized measures, researchers can draw meaningful conclusions about the efficacy of medical marijuana for CINV. The benefits of medical marijuana for cancer patients extend beyond managing CINV. Cannabinoids can alleviate other symptoms like pain, loss of appetite, and insomnia. Chronic pain, often significant for cancer patients, can be managed with medical marijuana. Cannabinoids interact with pain receptors, modulating pain signals. Loss of appetite, a common side effect of chemotherapy, can be addressed with THC, which stimulates appetite. By increasing appetite, medical marijuana helps patients maintain a healthy weight. Insomnia can be alleviated with cannabinoids, particularly CBD, which promotes relaxation and improves sleep quality. Medical marijuana can improve the overall quality of life for cancer patients. While evidence is promising, more research is needed to fully understand its potential benefits and risks. Ongoing clinical trials will further inform clinical practice and patient care. A medical marijuana can have side effects, and it's essential to use it responsibly under healthcare guidance. Common side effects include dry mouth, dizziness, increased appetite, and altered perception of time. These side effects are often temporary and subside as the body adjusts. Higher doses or prolonged use may cause anxiety, paranoia, or impaired coordination. Start with low doses and gradually increase under supervision. Be mindful of potential drug interactions, especially with chemotherapy drugs. Inform your healthcare team about all medications and supplements you are taking. Open communication with healthcare providers ensures safe and effective use of medical marijuana. They can provide personalized guidance and monitor for potential interactions. Despite scientific evidence and anecdotal reports, access to medical marijuana remains a challenge. Legal restrictions, social stigma, and lack of education among healthcare professionals create barriers. It's time to break down these barriers and ensure patients have access to this therapy. Legal status of marijuana in many parts of the world is a significant obstacle. Many classify it as a Schedule I drug, hindering research and limiting access. We need evidence-based policies recognizing the medicinal value of marijuana. Social stigma, rooted in misinformation, continues to cast a shadow on its potential. Challenge outdated perceptions and engage in open conversations about medical marijuana. Educate the public, policymakers, and healthcare professionals about its benefits and risks. Education will reduce stigma and empower individuals to make informed decisions about their health. Voices from the frontline. Patients share their stories. The most powerful testament to medical marijuana's efficacy comes from patients. Their stories paint a vivid picture of its transformative power. Sarah, a young mother with breast cancer, found relief from constant nausea with medical marijuana. It allowed her to eat, play with her kids, and regain her life. John, a retired teacher with lung cancer, was initially hesitant but found profound relief. Medical marijuana alleviated his nausea and provided a sense of calm. These stories highlight the human side of this issue. Behind the science and statistics are real people struggling with CINV. Medical marijuana helps them reclaim their quality of life and find moments of joy. It's about alleviating physical symptoms and restoring hope. Patients share their experiences with vulnerability and gratitude. Their stories inspire others to consider medical marijuana as a treatment option. The collective voices of patients are a powerful force for change. They remind us of the importance of compassionate care and access to effective treatments. CINV impacts a patient's life beyond physical discomfort. It can rob individuals of their energy, appetite, and ability to engage in activities. Medical marijuana offers a way out of this cycle, allowing patients to reclaim their lives. Imagine enjoying a meal, going for a walk, or reading a book without nausea. Medical marijuana restores physical, emotional, and social well-being. It helps patients reconnect with loved ones and re-engage in hobbies. The ability to eat, maintain a healthy weight, and enjoy life's pleasures profoundly impacts a patient's outlook. Patient testimonials inspire hope and raise awareness about medical marijuana for CINV. They provide a human face to this complex issue. Patient advocacy and scientific evidence are changing the conversation around medical marijuana. Healthcare professionals are engaging in open conversations about treatment options. Policymakers are reconsidering outdated laws and regulations. Patients are empowered to advocate for their right to explore all avenues of relief. The journey towards wider acceptance and accessibility of medical marijuana for CINV is ongoing, driven by patient voices. The evidence is clear. Medical marijuana offers a beacon of hope for cancer patients grappling with the debilitating effects of chemotherapy-induced nausea and vomiting. Countless studies, bolstered by the compelling stories of those who have experienced its benefits firsthand, shatter the misconception of marijuana as merely a recreational drug. Instead, they illuminate its potential to profoundly improve the quality of life for those battling a devastating illness. We stand at the cusp of a new era in cancer care, one where compassionate treatment extends beyond simply targeting the disease itself. It's about addressing the whole person, acknowledging the immense physical and emotional toll that cancer and its treatments take on individuals and their families. Medical marijuana, with its ability to alleviate not only CINV, but also other common side effects like pain, insomnia, and loss of appetite, embodies this holistic approach. It offers a chance to reclaim a semblance of normalcy, to find moments of joy amidst adversity, and to face the challenges of cancer treatment with greater strength and resilience. This shift requires a collective awakening, a dismantling of outdated stigmas, and a commitment to embracing evidence-based approaches. It's about empowering patients with knowledge, providing them with accurate information, and ensuring they have access to all available treatment options. It's about fostering open dialogues between patients and healthcare providers, encouraging honest conversations about the potential benefits and risks of medical marijuana, tailored to individual needs and preferences. While the progress made in recent years is undeniable, the journey is far from over. We must champion continued research, exploring the full therapeutic potential of medical marijuana for CINV and other conditions. Rigorous clinical trials will solidify our understanding of its efficacy. We must advocate for evidence-based policies that recognize the medicinal value of marijuana and prioritize patient needs. The road ahead may be long, but with each step, we move closer to a future where no one suffers in silence.